Hi,
Hi.
how are you?
Good.
My name is Pavi.
Okay.
I am one of the nurse practitioner student at St. Anthony College of Nursing. What is your name?
My name is Usha Dhawan.
Usha Devan. Okay. So what brought you in today?
I'm just feeling not good.
Okay. All right. So I have nurse told me that for a work purpose you need a head to toe assessment on you.
Yes.
Alrighty. So I'm gonna go ahead and wash my hand. So we are going to start Miss Devan's full head to toe physical exam on her today.
Okay.
Alright, so we will first start with two blood pressures while Miss Devan is sitting, and then one we will do while she's standing. Is there any limitation on any of extremity that I cannot able to do the blood pressure, or you are okay?
I don't think so. I'm okay.
Okay, alrighty. So I'm going to first go ahead and start with your left arm. You can go ahead and relax your arm like this, that's fine. Alrighty, so we have 152
I know.
over 89. Now we are going to go ahead and do it in your other arm. Alrighty, so you're gonna have the same feeling right here. And again, I just want you to go ahead and rest your arm. Very good. Alrighty, so we have 144 over 79. So now I would like you to stand up, and I will go ahead and do it one with the standing up. Alrighty, any preference using arm, or you are okay?
It doesn't matter.
Okay, so let's go ahead and use this one so we can rest that arm. Alrighty, you can go ahead and relax like this, and already. We have 166 over 88.
I know.
Okay, so we are done with the blood pressure. I'm gonna have you go ahead and sit down now. Take a nice deep breath. And I'm gonna go ahead and check your pulses. Alright, so at the same time while I was checking your pulse, I was counting your breathing as well. So now next I am going to just go ahead and check just head to toe for any asymmetry or any birthmarks or any abnormalities on your face. So just go ahead and look at me right now. Okay. Alrighty, so looking good. Now I am going to check your hair. So I'm gonna just go ahead and look at a couple different areas. Okay. Any problem with your hair? Any hair loss or any scalp dryness or anything? Okay. No problems. Alrighty. Okay. So now I'm gonna, Mr. Wan, I'm gonna have you do some facial movement with me. So if I can just take your glasses and put it right here for just a little bit until we do the facial. Alrighty, so first thing I would like you to do is go ahead and close your eyes super tight. Don't let me open when I try to open it. Good. Good. Alrighty, go ahead and open it. Now can you raise your eyebrow for me? Good. Can you puff up your cheeks for me?
Like.
Good. Can you frown? Good. Can you smile? Clench your teeth. Good. Now, go ahead and open your mouth. Good. Close. Good. Go ahead and open one more time. Can you move your jaw side up and down? Good. Can you stick out your tongue for me? And move it on a side, up and other side? Good. Alrighty. Can you push against my hand? Good. Can you push against my hand? Good. Can you shrug your shoulder high up and don't let me push it down? Very good, Miss Tuan. Now next I would like to do some sensation check on you. I have a few things that, one is a cotton ball that is considered as like just that I'm going to be touching. But I have a little Q-tips that is like a dull touch, and then the end is little sharp. So I'm gonna have you feel that first, and I'm gonna have you identify, and then I'm gonna be touching on your face various places, and you have to identify with your closed eyes whether it's a sharp or the dull, okay? So this is a sharp, and this is a dull, okay? So I want you to go ahead and close your eyes, and tell me this is a sharp or a dull.
Sharp. Soft.
Okay, how about this?
Soft. Dull.
That should be, is it sharp or dull?
Sharp.
Okay. Is it sharp or dull?
Sharp.
Is it sharp or dull?
Can you do again? Dull.
Dull. How about this?
Dull.
How about this?
Sharp.
Okay. Alrighty, go ahead and open your eyes. Now I'm gonna be touching you at the various places on your face, and when I touch you, you feel me touching you, say yes.
Can you
Okay?
repeat it again?
Sure. When I touch you at the various places. If you feel me touching, then you just say yes.
Okay.
All right, go ahead and close your eyes. Do you feel me touching?
Mhm. 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 Mhm.
Alrighty. Okay. Now I am going to do your ear exam. So first starts with my inspection of both ear. So I'm gonna just take your hair a little bit back. Alrighty. Okay, I'm gonna start observing your right ear, and then I'm gonna be touching for any swelling, any abnormalities, deformities, and I don't see that. I'm going to do same thing. I'm gonna go ahead and observe how everything's looking, and then I'm gonna be touching your ear and just checking your pinna, tragus, and mastoid process for any swelling, any abnormalities, any deformities. I do not see that. So now I'm going to look at in your ear canal, okay? Okay, and here. And I'm just checking your external ear for any abnormalities, any deformities, any discharge, any cerumen, foreign body, and your tympanic membrane. Looking great. I don't see any problem in your ear. Alright, so I'm moving into now another ear. And I'm looking the same thing, your external ear canal and your tympanic membrane. Alrighty. Now, Mr. Wan, I'm gonna be doing some hearing test on you. So I'm going to say some word or number in your one ear while closing your another ear,
Okay.
and I want you to repeat that.
Okay.
So we're gonna start with this ear first. I'm gonna be going close this one.
Okay. 27.
Okay.
9.
Okay. Alrighty. So now I have this vibrating tuning fork. I'm going to vibrate that, and I'm gonna be put it on base of your head, top of your head, and I want you to identify that vibration is equal in a both ear or one ear hears better than other. Okay?
Yes.
Do you hear equal in a both ear or just the one ear?
Equal.
Equal? Okay. And tell me when it stops.
Stop.
Awesome. Alright, now same thing, I'm going to vibrate and put it on back of your ear right here. And I want you to tell me when you stop hear that.
Okay.
And then I'm gonna be move it at front and tell me whether you hear the same thing vibration or no.
Stop. Stop.
Okay? Alright, we're gonna do the same thing on this ear.
Stop. Stop.
Okay? now we are gonna be checking your eyes. We're gonna do some different types of the eye exam. Also, I'm gonna be checking your eyes with a light. So just go ahead and look at me. I'm just gonna look at your eyes for your conjunctiva, iris, your eyelid, eyebrows. Just gonna look at a little bit and looking great. Alrighty. So I have a little card. I'm gonna have you wear your glasses. Alrighty, Mr. One, if you can just read this line for me.
P E C F D Y.
Good. Now, can you cover one eye?
This one?
Uh-huh. And tell me the smallest line.
At the bottom?
Any one that smallest that you can able to read.
F O D P C T.
Okay. Go ahead and close another eye and read which one you can able to read.
D E F P O T E C.
Good. Alrighty. Okay. And now I'm just gonna be checking your lacrimal glands first. So I'm gonna just move your glasses for 1 second. Okay. Checking your lacrimal glands, and that looks good. Alrighty. Now, Mr. One, I'm gonna be wiggling my fingers from various directions, and I want you to raise your finger the direction that you see. If you see on top, then you raise your finger, say you see it. And if you see only one side or both side equally, you just raise your finger both direction, up here or here.
Okay.
Okay, alright. Raise your finger if you can see my hand coming. Okay. Okay. Okay, alrighty. Now, I am going to follow my finger. So just go ahead and look at me, okay? Look at my finger, okay? Follow my finger. You don't have to, you can just keep it that way. You can just follow my finger. Okay. Now I want you to stare at that picture and then look at my finger. Then look at back to the picture, look at my finger. Look at back to the picture. Good. Okay, Mr. One, now I'm going to do the wiggling test again.
Okay.
Now this time what we are going to do is you're gonna be closing one eye and I'm gonna be closing at the same side. And then I'm gonna be wiggling my finger. And when you see wiggling my finger, you raise your finger up, okay? All right, so go ahead and close that eye. All right. Good. So now we're gonna do the same thing with other eye. So go ahead and close your other eye. Good. Good. Very good. Alrighty. Now I'm going to check your eyes with a little bit light, okay?
Okay. Am I supposed to remove my glasses?
No. I will tell you just in a little bit.
Okay.
I'm just gonna go ahead and look at me. I'm gonna shine a light. Okay. Go ahead and look at me. Alrighty. Now we are gonna go ahead and remove your glasses. And I'm gonna be looking a little closer. And this is called a fundoscopic exam, looking for your fundus and your red reflux, and you have a great red reflux. I'm coming closer to you. Alrighty. Alrighty, so now we are gonna be doing your nose exam. So I'm gonna just be looking first for any asymmetry or any deformity. Now I'm gonna be touching your nose. So I'm doing my palpation. Now, Mr. One, I'm gonna have you close one nose and breathe in and out through other ones. Take a nice deep breath, in and out. Any breathing problem?
No.
Okay, go ahead and follow the other one. Very good. Now, I have some test for you. So I'm gonna have you close your eyes and I want you to identify what smell is this. Okay?
It's like a lemongrass or lemon.
Good.
Is it?
Mm-hmm. That is right.
It's like a. That is my little name.
Mm-hmm. That is right. Alrighty, go ahead and open your eyes. Now I'm going to check your nerves with a light. So I'm just checking for your nasal septum and for your mucosa, any polyps, any discharge, any swelling, and everything's looking great. And I don't see any. All right. All right, now we are going to check your sinuses, okay? So when I touch you and put a pressure, you let me know if you are having any pain, okay? Alrighty. Any pain?
No.
How about any pain?
No.
Okay. All right, so now we are going to do your mouth exam. And I'm gonna have you stick out your tongue, say out loud, ah. Say ah. Alrighty. Good. Can you lift up your tongue up? Good. On side. Good. Very good. Go ahead and close it. So for I have not performed the gag reflex, but basically if I have to produce the gag reflex, I will just push it a little far and I would able to get the gag reflex. Same thing during the eye exam. I did not do the corneal reflex, but basically with the cotton wisp, I will have patient look at the front one focal area, and I will touch the eye with the with the cotton wisp, and will look for the blink response. All right, now we are going to check your lymph nodes.
Okay.
Alrighty, so I'll be touching you at the various spot for looking for any swellings or any tenderness. Now I'm just looking your trachea for a midline, and I'm just checking your trachea, and it is at midline. All right, so now we are going to check your thyroid glands. So I'm gonna have you drink water, but don't swallow. And don't swallow. Okay, go ahead and relax. Go ahead and swallow. No. You can keep the water in your mouth
Oh.
and then you can swallow.
Oh.
Okay, go ahead and swallow now. Okay, no swelling. No. Okay, that's good. All right, now go ahead and take this from you. All right, now we are going to do some neck movement. So you just follow me. Go ahead and look it up all the way back, all the way up in a ceiling. Good. Look it all the way down. Good. Now can you touch your ear to the shoulder? All the way. Good. How about another side? Very good. Now I want you to touch your chin to the shoulder. How about other side? Very good. Now, Mr. Wan, we are done with the upper part. Now we are moving into the lower part. So I'm going to have you turn a little bit on this side because I want to check your spine and check your posterior back and lungs. Alrighty. So first is my observation of her posterior back, and now Miss Dhawan, I am going to touch you different spots and let me know if you are having any pain.
Okay.
Also I am checking for her neck contour and that looking good. Alrighty, so I'm checking for your cervical spine for any pain. Any pain? Going into the thoracic. Any pain? Any pain? Any pain? Going into the lumbar. Any pain? Any pain? Any pain? Any pain? Going down to the sacral. Any pain? Alrighty. Any pain? How about any pain? Any pain up here? Any pain? Any pain? Okay. Alrighty. Now I'm going to check how your lungs is moving. So I'm gonna have you take a nice deep breath in and out. One more time. Lungs expansion. Go ahead and take a nice deep breath in and out. Very good. Alright, Mr. Wan. So now I'm going to touch you at the various spot. When you feel me touching, then you say 99. My palm is going to be touching you, okay? Alright.
99, 99, 99, 99, 99.
Alrighty. Now I'm going to be tapping on your back, okay? Alright. No, you don't have to sit. I just want you to go ahead and relax now. Good. Alright. Now, Mr. Wan, I want you to take a nice deep breath and let it out. And hold it. Alright, go ahead and take a nice deep breath again, let it out and hold it.